Hello, my name is Karina Venter. I'm an allergy specialist dietitian from Denver, Colorado. I'm also chair of the EAACI work group on immunomodulation and nutrition. So it's a huge pleasure for me today to discuss the topic of immunonutrition on World Food Day. We will discuss a number of topics. Why is immunonutrition important? Why is it of interest to patients and really all of us? What's the main challenges and priorities we are facing? What are the new initiatives we should be focusing on and future research strategies? And then I'll just give a general message on World Food Day. So why is this topic important? Immunonutrition used to have its roots in the treatment of critical ill patients on an intensive care unit. And the focus really was on how nutrients affected the immune system. But we've become to be aware of the fact that really immunonutrition is much bigger than this, and that immunonutrition really perhaps could be defined as the effect of food patterns, food quality, food diversity, food intake, and then nutrients within food, and its effect on the microbiome, epigenetics, epithelial barriers, metabolism, and then eventually affecting the immune system either via all these different mechanisms or directly. This was highlighted really in the latest publication of the EAACI guidelines on prevention. If we compare the current guidelines with the guidelines we published about 7 years ago, you can clearly see the importance put on healthy, balanced diet and also nutritional status and overall health. As part of the task force on immunonutrition, which is now part of the work group on immunomodulation and nutrition, we wanted to really focus on three current challenges and priorities. And the first one was that we wanted to look at single nutrients and their importance in allergy prevention. Well, while we know that single nutrients also function alongside other nutrients. And so the first single nutrient that we focus on was omega-3 fatty acids. And we got the task force together, reviewed the literature, and our main conclusion was that dietary intake of fatty acids may influence the development of both inflammatory responses and tolerogenic immune responses. And what this basically means is that intake of dietary fatty acids, particularly omega-3 fatty acids, may prevent inflammation, but it may also enhance tolerance, which means we may not develop allergic diseases. But we also understand that there's a number of limitations in the current studies, and the main one being that we really need to test people's serum fatty acids before we start supplementation. And it also would be good to know what their baseline intake is before we start supplementation. Then the next current priority we wanted to focus on was nutrient excesses and nutrient deficiencies, knowing that both nutrient excesses and deficiencies may have dramatic effects on the immune system. So we performed a systematic review looking at food, nutrient, and food patterns in pregnancy itself. And the main conclusion we came up with after reviewing the evidence over a period of about 2.5 years is that perhaps prenatal supplementation with vitamin D may affect the development of asthma, in that supplementation with vitamin D may prevent the development of asthma in the offspring. But we were very clear looking at the studies focusing on food and food patterns that there's a huge need to perform randomized trials or clinical trials using foods and food patterns. So not just focusing on single foods and single nutrients. The third current topic we wanted to focus on was really to look at this interaction of overall food intake and dietary patterns in development of allergic diseases. And here we focused on pregnancy, breastfeeding where there was no data, and the infant diet. I'm sharing with you on the next slide our conclusion about the infant diet. The paper was referred to as the EAACI position statement on diet diversity in pregnancy, infancy, and childhood. And so the conclusions from the study, as I've said, focusing mainly on infants, was that we recommend that infants at high risk or normal risk of developing allergic diseases should have a diverse diet, which is a varied diet. We basically measure diversity by just counting number of foods, number of fruits, number of vegetables. And we said that there's some limited evidence that a diverse or varied diet in infancy may develop food allergy and other allergic diseases in later childhood, and that there was no evidence of harm by having a more diverse diet. But we also said that there were some limitations in the studies and that we really need to standardize methods of collecting data on diet diversity and reporting data on diet diversity. Moving a little bit outside of allergy, we also performed a systematic review looking at ways of preventing COVID-19, but clearly there's no studies that we can currently quote on COVID-19 per se. So we focused on studies looking at prevention of respiratory infections, and again, very limited conclusions that we can make to say that there's some evidence that zinc supplementation amongst children in Asia and vitamin D supplementation amongst adults in the US and Canada may potentially prevent the development of respiratory infections. So I've summarized some main points and current topics of interest for you. So now moving on, what are the new initiatives and priorities we're focusing on? We think we really need to understand more about the effect of ultra-processed foods on allergy outcomes. We really need to increase our knowledge of micronutrient deficiencies and allergy outcomes, and whether perhaps deficiencies set for healthy eating is of relevance for allergy prevention. And then we wanted to expand our knowledge about respiratory infections, particularly in this times of COVID-19. And so we want to review the evidence of dietary interventions in children after acute respiratory or skin infections and how to improve and support them on their way to better health. So this is a busy slide, but if you do have access to the journal Allergy, you may want to look at this short communication that I wrote with Dr. Liam O'Mahony. And it really nicely summarized what we currently know about nutrition and epithelial barriers, nutrition and the gut microbiome, nutrition and the immune system divided into the innate and adaptive immune system, and then ideas for future outcomes. And we nicely summarize that we really need to improve our knowledge about the role of nutrition on gut, skin, and other epithelial barriers. We need to understand where the nutrients function on their own and how they better function in combination. We need to look at the interactions I've already described. We can't ignore nutritional status of individuals when we start doing these interventions. We need to know how long we should do these interventions. We should look at the impact of individuals' underlying disease process, perhaps on management as well as prevention. And then we need better definition of whom of us are at risk of developing different diseases, obviously with a focus on allergic diseases within the context of EAACI. And so with that, I'd like to conclude by saying my message on World Food Day would be: try to eat healthy food as much as you can, but enjoy what you're eating. Try to eat a variety of food, but remember each additional food could potentially help with prevention of disease and potentially help to increase the diversity of the gut microbiome, which again can positively affect immune outcomes. Try to focus on home cooked food. We're all very busy, but when possible, cook and stay away from ultra-processed food, although we need a little bit more evidence on how ultra-processed food in particular affect allergy outcomes. And if you are a healthcare professional, a member of EAACI, and you're interested in this very exciting field of research and clinical practice, do become a member of our work group. So with that, I'd like to thank you for your time.